If you've had back surgery but you're still in pain, I want you to know something right from the start. You are not alone, and your experience is absolutely valid. In this explainer, we're going to tackle this incredibly tough topic. We're going to move past some really unhelpful labels and explore the real reasons and the modern solutions for that persistent pain. Let's get into it.
This is the question, isn't it? It's the one so many people ask, and it's just filled with frustration and confusion. It's such a heavy burden to carry when you've gone through a major procedure expecting relief, only to find the pain is still your constant companion. We hear you, and today we're going to unpack this together.
Okay, first things first. Before we go any further, we have to talk about the name that doctors sometimes use for this condition because, frankly, it's a huge problem.
So the clinical term is failed back surgery syndrome, or FBSS for short. You might also hear it called post-laminectomy syndrome. But let's go back to that first name and just focus on that one word, failed. This term is a massive problem because it suggests that either the surgeon messed up or that you, the patient, have somehow failed. And that is just not true.
So the most crucial thing we can do is to reframe this completely. We are not talking about a failure of any kind. What we are talking about is the beginning of a brand new, distinct medical condition. It's a condition that requires its own unique investigation and a totally different treatment plan. So let's look at what's actually going on under the hood.
So if it's not a failure, then what in the world is causing the ongoing pain? Well, the answer is almost always a mix of complex biological factors, and, some of the most common reasons might actually surprise you. You see, the pain can come from a whole bunch of different sources, and it is rarely just one thing. We could be looking at internal scar tissue from the healing process itself. That's what epidural fibrosis is. Or maybe it's something called adjacent segment disease, where the levels above or below the surgery site get extra stress and start causing a new problem. And sometimes it's that the nerve itself is just still angry and keeps sending out faulty pain signals. Let's break down a couple of the biggest ones.
Epidural fibrosis is a really big one. So after any surgery, your body's natural healing process creates scar tissue. But sometimes that scar tissue can actually form around the spinal nerves, almost like gluing them down or squeezing them. This puts pressure on the nerves and, you guessed it, causes more pain. So in a weird way, your body's own healing can become the source of a new problem.
And this visual, it gets to the heart of another huge concept, neuropathic pain. You see, even after the original issue, like that herniated disc, is fixed surgically, the nerve that was being pinched can stay damaged or, let's say, irritated. It basically becomes like a faulty electrical wire that just keeps sending pain signals to the brain over and over again, even when there's no new injury causing it.
So, with all these different possibilities, how do doctors figure out which one, or which combination, is causing your specific pain? Well, it takes a really careful and thorough investigation, a true diagnostic journey.
A proper modern workup is a multi-step process. It all starts with your story, a super detailed history of your pain. Then comes a hands-on physical exam, followed by advanced imaging. And sometimes we'll use something called diagnostic injections, which act like detective work to help us pinpoint the exact nerve that's sending those pain signals.
And when we talk about imaging, I have to tell you, a recent MRI is almost always mandatory in these cases. It is simply the best tool we have for seeing all the soft tissues, the discs, the nerves, any scar tissue, to really understand what's happening on a structural level. You'll also probably hear the word fluoroscopy thrown around. All this really is a live X-ray. It's like an X-ray movie that lets a pain specialist guide a needle with incredible precision for those diagnostic nerve blocks or treatments. It's a critical tool for making sure we get the medicine exactly where it needs to go.
Now, I want to touch on the psychological evaluation because this is so important. This is not about suggesting the pain is in your head, not at all. We know that living with chronic pain impacts your mood, your sleep, your entire life. This evaluation helps the team understand that full picture and make sure you have the mental and emotional support you need to get through this. It's all about treating the whole person.
Okay, so once a diagnosis is finally made, what's next? Well, here's the really good news. The playbook for treating this condition has changed dramatically. We're moving way beyond just thinking about another surgery.
This chart really shows the huge shift in thinking. The old way of doing things often just led to more surgery, which, as we know, can sometimes create even more scar tissue and make things worse. But the modern approach, it's totally different.
It focuses on these sophisticated techniques that actually target the pain signals themselves, all coordinated by a specialized team.
One of the most promising of these modern treatments is called Spinal Cord Stimulation, or SCS, and the process is very careful and methodical. First, you're evaluated to see if you're a good candidate. Then, and this is the best part, you get to do a trial run. Temporary leads are placed so you can test it out in your daily life. The big question is, does it cut your pain by at least 50%? And only if that trial is a big success do you move forward with a permanent implant. You get to test drive it first.
And the evidence for this is powerful. This brings us to our evidence corner. A major study in the top journal Neurosurgery directly compared spinal cord stimulation to having another surgery for this exact problem. The bottom line? SCS gave significantly better long-term pain relief. This isn't just a theory, it's backed up by really high-quality science.
So this all brings us to what might be the single most important takeaway from all the research. It's not about a single magic bullet procedure or one heroic doctor.
The crucial insight is this. The best, most successful outcomes happen when you have a coordinated team of different experts all working together on your case. This is just not a one-person job anymore.
And this is what that ideal team looks like. You've got an interventional pain physician who's kind of like the quarterback, a physical therapist to help you improve your function, a psychologist to give you coping strategies, and your original surgeon. All of them talking to each other and working together for you.
Okay, so after hearing all of this, what is the one thing you can actually do? What is your most important next step to really take control of this situation? Here it is. The single most powerful action you can take is to shift your focus. Stop asking, what's the next surgery? And start asking, how can I find the right multidisciplinary team? That is the real game changer. So, here's your doctor's note for today. I want you to feel empowered in your next appointment. I want you to use this exact phrase. Could you please provide a referral to a multidisciplinary pain management specialist who has experience with post-laminectomy syndrome?
I want to leave you with this one final thought. It is so easy to feel like you've hit a dead end. But what if this moment of persistent pain isn't an ending at all? What if it's actually an entrance, a doorway to a more sophisticated, team-based, and ultimately a more hopeful way to feel better? There is a path forward.